Before I start, I want to thank a lot of people who've helped set up this room and helped me with this presentation. First is my neighbor Matthew, who's helped me with a lot of the computer problems I always have. Of course, I have to thank Jim White for inviting me to talk here. I have to thank Sherry and her husband Steve. I don't know where Sherry disappeared. I guess she did. There they are in the back. They've always been very supportive of projects in the clubhouse. And I also wanted to thank George Lippert. He's not here. And Patricia. Patricia's here. Patricia has a stretch class in our clubhouse. Where's George? Oh, okay. So thank George for producing a little CD for me. So before I start, I'm going to set the mood with a little music. Compose. Yeah, can you hear me now? Okay. So, to me, this piece of music is just fantastic. Composed by a 19-year-old guy. And some of you will know I'm talking about Frédéric Chopin. So, please listen, and that'll set the mood. And I will explain a lot of stuff about this lecture to you. And I hopefully won't put you to sleep. And I know Stu will enjoy this. He's one of the best pianists around this whole area. Fantastic pianist, and I'm lucky enough to play with him sometimes. 19-year-old guy. This is the London Philharmonic conducted by Andre Previn. And this is from the Chopin movie. It's one of the best movies I've ever seen. Has 10 beautiful music pieces. This is the end scene where Chopin is dying or dead at the age of 37. And his sister is taking his heart back to Poland. Chopin grew up in Poland, and his father sent him to France, where he starved for a long time. Composed 600 pieces by the time he died. This is one of them. So, I played this piece to tell you a little story about why I got onto NBC for half an hour. Being on NBC for 1 minute is about $10,000. Half an hour on NBC, you do the math. So here's the story. I was just a regular guy practicing in New York when I met this guy, Roger Bone. Roger if Elvis was the king of rock and roll, Roger was the king of intensive care. He died at the age of 57 young, but before he died, and his obituary was written up in the New York Times, Roger had written 40 books on intensive care. And at the time I met Roger, I met him in India in a place called Kashmir. And somehow there was a connection between me and Roger. And more than I wanted to do it, he wanted to help me publish and get known. So he helped me with my first paper. And then one day I was listening to Chopin, and a light bulb went off in my brain, and I said, gee, we need, all the doctors were getting sued in New York at that time. There was a crisis, malpractice crisis. And I saw a headline in the New York Times which said, doctor sued for $50 million. And I didn't know at that time that most of these awards get reduced, but I said, this is ridiculous, $50 million. And somehow I thought we have to educate doctors about the legal problems in medicine. So I met Roger once again, and by this time we were friends, and he had come to visit me in the hospital where I was working, which was Flushing Einstein in New York. And we had become good friends. And I told him, what about publishing a book to educate doctors about the law? And he said, Jim, do you know what you're getting into? I said, his first question was, what do you know about law? And I said, nothing, but I'm willing to learn, and I'm willing to take a paralegal course. So that was interesting.
A little louder, Jim.
Yeah.
We can't hear you back here.
I'm so sorry. Okay, now can you hear me? Cool. So I took the paralegal course, and because Roger was on the book, and somehow I luckily got Judge Kassoff, who's this judge here, who's a judge on a higher court at the appellate court. I knew I could get anybody to write in this book. By the time the book was published, we had one senator from New York, Senator Dunn. We had the judge on the busiest court in the whole United States, New York Supreme, Manhattan, Judge Gammerman. We had professors from Stanford, Harvard, Cleveland Clinic, Mayo Clinic, you name it. I could get anybody to write in this book. We set a deadline for 1 year. We had to actually turn down some of the authors because they didn't produce on time. But anyway, the publisher sent the book to NBC, and that's how I got on TV. So that answers the first question. Let's talk a little bit more now about sleep. And I want to thank Dan Vega for giving me this pointer. Dan, it's very, very helpful. Okay, everybody knows. Oh, sorry. Let me go back to that slide. This is the Pentagon building. It's not in Washington, D.C., but in Arlington, Virginia. It's a 5-sided building. Holds the biggest staff in the world, biggest office building in the world, 30,000 people. The might of the United States is here. And what does this have to do with sleep? Well, sleep has a lot to do with dreams and has a lot to do with post-traumatic stress disorder, or PTSD. And I had a contract with the Department of Defense, and in San Diego I saw a lot of patients who had sleep problems. Most of them young guys who had come back from Iraq and Afghanistan with PTSD and couldn't sleep at night. So one of the most gratifying things I ever did in my career was to treat sleep disorders. I had two patients one patient literally went and touched my feet. He said, "You are the greatest." And I did a lot of things in my career. I did internal medicine, I did pulmonary medicine, I did legal medicine, and all that kind of stuff. Now, so 2 stories I'm going to tell you about what happens if you don't sleep. The first story was from my own practice. Had a 46-year-old guy. One day, I'm sitting in my office, and here are 2 of my star students, Noah and Shirlene, who know. Shirlene is the one right in front. She just got into New York State, I think?
Stony Brook.
Stony Brook. Wonderful. Most of my students have gotten into big, big hospitals here. So I'm very proud of them. And Noah, where's Noah? Right back there. Noah, I met Noah at one of the lectures I gave at UCSD, and he knows a lot about Chopin, and we started talking about Chopin. And so Noah is a great pianist too. He taught me a couple of Chopin pieces. Anyway, so this patient, I get a call one day from a lawyer saying, can you help us with a case? I said, what's the story? He said, there was this guy, businessman in El Cajon, who was driving and went through a couple of traffic lights. He hadn't slept for a couple of days. And one night, he went home, took a nap, and then wanted to go have a drink with a friend of his. Had about 2 beers, and when he was coming back to his home, he had left his 10-year-old son at home. Suddenly, the El Cajon police stopped him because he went through these lights and threw him in the slammer. And he got out on bail and saw this big criminal defense attorney who contacted me, found me through the internet. And I told the attorney, I don't know if you can help him much, but I mean, one of the defenses that a lot of lawyers use is if you did something in your sleep, you're not conscious of it, that's a defense. So he was trying to say that this guy might have been in his sleep because he hadn't slept for a couple of nights. The guy came into my office, and I told him you need a complete polysomnogram. So there are two kinds of sleep studies. One is a home sleep study, which we do a lot of, and one is a complete sleep study, which is called a polysomnogram. So I told him he would need a polysomnogram because this was a serious offense. The guy says, I'm not going to do it. I said, okay, I'm going to have to call your lawyer. And I called his lawyer, and I'm sure you can guess what the conversation was. I'm sure his lawyer must have said, well, if you're going to be an ass, I can't represent you. So the lawyer says, Jim, take 5, and he called me Dr. Vevaina, take 5, and I'll call you back in 5 minutes. I said, okay. He calls me back. He said he'll be in your office 9 o'clock next morning. And he was. We did the sleep study. He had severe sleep apnea. Now, sleep apnea is a serious condition. People die from it. And if you have sleep apnea, you need to inform, before any operation, you need to inform your doctor that you have sleep apnea. A couple of my friends here in Auberge are smart. The doctors have diagnosed sleep apnea and put them on a CPAP machine. This is a protection against stroke, and I'm going to show you the evidence that if you don't diagnose sleep apnea, you can get a stroke and you can get heart attacks. One more wonderful thing about the CPAP machine is that it lowers blood pressure. A lot of lay people don't know this. So it's a non-invasive, no pills, no medicine treatment for high blood pressure. So let me just move on. So anyway, we went to El Cajon Court. I testified over there. The judge was pretty hard on him. The prosecuting attorney was really well polished. She was a young woman, about in her mid-30s, did a great thing. But anyway, the long and short of the story was that he got a lesser offense, and he was still put in the slammer, but he was there for a less time. About a month ago, in the Union Tribune, there was a story about a woman who was put for 17 years in prison because she killed somebody while intoxicated. So if you have sleep problems and then you drink, you're really asking for trouble. One more really interesting story. This is an old textbook of sleep, and you can see that it's got a lot of information in it. It's all technical. I've tried to make it simple for this audience so that anybody can understand it. So the second story was written by Dr. Mark Marwald. He's another famous sleep specialist. I shouldn't say another, a famous sleep specialist. The story was like this. It's a story about a parasomnia. It's a different sleep disorder. Now, the last time I looked in this book, there's about 172 different sleep disorders. Here's the story about the parasomnia. 24-year-old American-born student, top student, all A's, went to Japan to teach English. He wanted to go back to Japan to start a business, came back to Oregon, and hadn't slept for a couple of nights. Had only slept maybe 2 or 3 hours. He went driving around with his friends. Apparently, he had one sniff of marijuana or something. And as he was driving with his friends, some cops came behind him. He told his friends, "Don't worry, I know the cops," which wasn't true. Suddenly, the cop pulls him behind the cop car. This guy lost it, slammed the cop in the jaw, and broke the cop's jaw. A couple of other cops came on, arrested this guy. They don't publish the whole story in the book, but apparently he was put in jail and not let out. 24-year-old kid. And the case is now on appeal. So lack of sleep can really kill you. One more thing I'm going to show you, and I'll show you the evidence for it, which was published recently. If you don't sleep, you put yourself at a higher risk of stroke. So sleep is really important. Now, who needs more sleep and who needs less sleep? If you have some form of cancer, some kind of rheumatologic disorder, joint disorder, some kind of inflammation in the body, heart disease, you need more sleep. Most people think you need about 7 hours of sleep, but the ideal amount of sleep is about 8 to 10 hours, according to every textbook I've read, and according to my own experience also. So these people who have certain medical conditions need more sleep, because in your sleep, the body regenerates. In your sleep, all these blood cells come out from your bloodstream, fibroblasts, polymorphonucleosides, monocytes, all these cells come out, and the body regenerates. There's also something called melatonin. Melatonin is a sleep-inducing agent. The body normally produces it by the pineal gland and the brain, but if you have less melatonin, and as you get older, you have less melatonin, and all these muscles in the back of your throat get weaker, so you are more prone to sleep apnea. Let me move on with some more important stuff. Here's another condition that's a sleep disorder. Here's a guy who's got burning feet. This is a nice picture some artists made out. And that's called restless leg syndrome. We've seen quite a few cases. My students who have seen Shirley, and I'm sure you've seen at least one or two cases. These people, their feet burn at night because they have high blood sugars. And they have an iron deficiency which causes their legs to be restless at night, and they kick off. And in a case like this, again, we would do a complete sleep study. But there are very few real cases where we need a full sleep study. Most of the time, we can do a study at home and give you all the information and data that you need. Well, a lot of people don't know how to deal with doctors, but hopefully you don't make your doctor crazy like this. Okay, here's another interesting thing about sleep apnea now. We can tell by just looking in the back of somebody's throat if they've got sleep apnea or not. If somebody snores loud, and I know Tanya's here, right? Tanya diagnosed her husband with sleep apnea because he stopped breathing in his sleep. If you look in the back of somebody's throat, oops. Here's the pointer. There are 4 different kinds of configurations of the throat. This was discovered by an Indian doctor called Malampati, so it's called the Malampati classification. And all my students know this. You just look in the back of the throat. If you got this and you can look at the back of the throat clear, you're not going to have sleep apnea. Whereas if you can't see this opening here, and it's very narrow, there's almost a 99% chance that you've got sleep apnea. So most of the times I can diagnose sleep apnea without doing a sleep study. I can just look in the patient's throat, and I made up a questionnaire, 37 questions. I just have them fill out this questionnaire, and we can 99% of the time diagnose if they've got sleep apnea or not. And as I said earlier, sleep apnea is a serious condition and needs to be treated. Now, just going back to some middle school and high school anatomy, this is the cerebellum. One of the things that will decide how long you'll enjoy the Obez Clubhouse and how long you're going to live, there are 5 things. The first one is your genetics. You can't do anything about that, although there's a lot of promising information on gene therapy. And Noah's work, where did you work, Salk?
I don't work. I work at Stanford, which is next to
Oh, okay. But gene therapy is going to be probably one of the treatments for cancer, and there's a lot of new stuff that's going to be coming out in the next 10 years. In fact, the prediction is that there'll be no more scalpels used to do surgery. It'll be bloodless, and all this new technology is going to stem cell therapy and so on. All this is going to be coming out in the next 10 years. We're going to have driverless cars. Artificial intelligence, one of the biggest companies in the world now, the most promising, is a company in China that is working on artificial intelligence. And Apple recently bought a company that does facial recognition and can almost tell if somebody's telling the truth or lying. That will be really, really useful in a court of law. Because Apple bought this company many years ago, and it was published in the Union Tribune. But this company in China was announced on CNBC, and I think it's going to be very promising. So this is the cerebellum. This is where if you drink too much alcohol, you damage this and you have ataxia. So you don't walk very steady. So one of the things that will decide your fate will be how much alcohol you drink, what kind of food you eat, the quantity of food you eat. Sorry, the quantity of food you eat, the kinds of food you eat, and how much you exercise. I see a lot of people in Auberge don't exercise. I see the same people every single day in the gym. How much should you exercise? If you're going to have 3 big meals a day, I think you should exercise 3 times a day. Minimum, you should exercise 15 or 20 minutes a day. There is something magical about exercise that even doctors don't understand. But one thing that happens with exercise is that it changes the chemistry in your brain. So exercise is really a must. If you have genetic conditions, I have a condition that everybody in my family has, and it's called genetic hypercholesterolemia. Almost all my family members died of heart attacks or stroke. My father died of a stroke, so I am scared like crazy about getting a stroke. And so I'm in the gym almost every day, almost. Okay. These are not. How much sleep do you usually get? Tom Edison got only about 3 hours, and before Edison discovered the light bulb, people had much better sleep patterns. People went to sleep when the sun went down, woke up when the sun, and so it's always better to wake up earlier and not go to bed too late. What are the things that keep you up at night? Computers, television screens. The worst thing you can do is be watching a television screen, and then the light from a television and a computer is the blue light, and I will show you the treatment for that in one of the slides that come up. But you want to avoid working on your cell phone, working on your computer after you've had your meal and after when you're ready to go to sleep. The bedroom should be used only for sleep. Every sleep specialist recommends that. One more trick I learned about sleep. Most men have to wake up at least once at night, and even some women, to go to the bathroom. I went to a couple of sleep lectures given by a well-known sleep doctor from Scripps. His name is Milton Ehrman, and he taught me this trick. He said, one of the things that happens is if light hits your brain, it's hard to go back to sleep. So he said, get used to walking to your bathroom almost in the dark, just have your eyes open just a little, and walk to the bathroom, come back, and go into bed, and you're going to fall asleep right away. So it works. I do it myself. You know, I keep a flashlight which is not bright, a very low, dim flashlight to go to the bathroom, because I wake up at least once a night. And most people I talk to in Auberge have the same problem. Jay Leno sleeps about 5 hours. President Clinton only slept 5 to 6 hours. Janis Joplin never went to sleep. She didn't want to miss the party. She was a famous singer. So, if you need an alarm clock to put you to sleep, you're probably not getting enough sleep. Sorry?
To wake you up.
To wake you up. So, I think about at least a minimum of 7 hours of sleep. People who are sleep deprived don't function well the next day. Working people know this. They can't concentrate. There's some fogginess in the mind, and they don't do well. So, also remember, when you are sleeping, your brain is very active. There are a lot of dreams that occur, and they occur in REM sleep. And in REM sleep, the brain normally goes through a cycle every single night. It's about 1.5 hours. It's between REM, which is rapid eye movements. If you watch a baby, his eyes are moving very rapidly when he falls asleep. You see the baby going off like this, and his eyes are moving. So REM sleep is what you want more of. And so for every 1.5 hours, we go through the cycle. REM sleep, non-REM, REM sleep, non-REM. And there's something called REM latency. So how much time does it take you to get into your REM sleep? That's really important. And how much REM sleep you have. So by doing a sleep study, we can tell you exactly how much REM sleep you're having and how long it takes you to fall asleep and how much time you're awake and so on. And I'll show you one of those. a lot of car accidents are caused by people who don't get enough sleep. In fact, most bus drivers, and I think they should do this for plane drivers also, some of them fall asleep at the wheel. Each year there are about 100,000 car accidents, and fatigue is the number one factor affecting pilots. President Bush once fell asleep under a table from lack of sleep. Now this was a really changing case because I was in New York at the time when this intern prescribed the wrong medication. This was at the New York hospital, Cornell Medical Center. An intern was called in the middle of the night. In those days, when I came to this country 41 years ago, we worked 24-hour shifts in the emergency room. It was brutal because the next morning we couldn't even wake up to have a breakfast. This doctor was called, this intern, she was a doctor, and it was a 17-year-old girl whose father was a very famous author and wrote a lot in the New York Times. And she prescribed a combination of, I think, codeine and a sleeping pill for this patient, for the 17-year-old girl who had taken some marijuana or something, and the patient died. After that, the father wrote in the New York Times, and all the laws in New York were changed, and then all over the country, the laws for doctors were changed. So now these doctors, young or doctors to be, have it much better than we had, because now there's a prescribed number of hours that a doctor can work. And you don't want a doctor who hasn't slept to take care of you. You don't want that. And I think you want a doctor, you want to develop a relationship with your doctor. A lot of people don't do that. Nowadays, it's not like the old days in medicine. I saw the old days when there were professors and it was like in the movies. Every professor came with a bow tie and he was the author of many books and stuff like that. Nowadays, it's like factory medicine. So unless you develop a relationship with your doctor, and so if a doctor's got 1,000 patients, how is he going to choose which one he's going to give more time to? You got to do little things to make the doctor develop a relationship with you. I remember patients who would bring me a frappuccino or make postcards for me, and those patients got the best out of me. So I think you need to learn that. A lot of people don't know that. What's that?
Bribe your doctor.
Bribery. Hey, pharmacists, these pharmaceutical companies bribe doctors all the time. It's just so common. Now, alcohol is also, it's also been shown that people who sleep too much have a propensity to get Alzheimer's dementia, and they get amyloid deposits on their brain. This is all published research here. Unfortunately, the slide's a little upside down. So, there are three conditions where you have excessive sleepiness. One is a very deadly disease called narcolepsy. Narcolepsy is a disease, it's genetic. Actually, I have one student who's got that, and I've had a couple of patients with that. In narcolepsy, they get hallucinations. They're called hypnagogic hallucinations. And the scary part about narcolepsy is they can't move. They can be awake or slightly asleep, and they have cataplexy. They can't move their legs or can't move their arms. I had one patient who used to drive parked cars for Toyota Motors in East County. And this patient, he would fall asleep every few hours. His first accident was when he banged a Toyota into a pole in the parking lot. After that, he fell off a roof. After that, he had a third accident where he broke his ribs. And this guy had no money. He applied for Social Security, and the judge turned him down. I couldn't believe it. Then he found a lawyer who understood his case and represented him in front of the Social Security judge, and he was given some benefits. The guy still had no money. He used to come to my office, and I had to pay for his gas because he was so poor. He lived in his car. And he couldn't get a job because he had narcolepsy. And it's really a terrible disease. At Stanford University, where one of the biggest sleep professors is Dr. Dement, who wrote one third of this book, he found a way to make dogs narcoleptic. And so there are certain breed of dogs, Doberman Pinschers, who you can make narcoleptic. So that's one disease where you have too much sleepiness. I met a lady here in Auberge. She had this problem. She was excessively sleepy. And I told her, we can do a home sleep study for you, no problem. She said, are you going to charge my insurance? I said, of course. It costs us money to do the sleep study, so of course I'm going to charge your insurance. She said, well, in that case, I don't want to do it. Now, I don't understand this kind of thinking, and I had to deal with this a lot as a doctor. People, a simple test gives you so much information about what's happening 1/3 of your life, and they don't want to do it. I don't get it. So anyway, that's the second condition. And one is called idiopathic hypersomnia. So hyper means too much, and somnia means sleep. Some people just sleep too much, but these are all precursors of Alzheimer's or some kind of dementia. So if you are sleeping too much and you fall asleep in the daytime, that's a clue that you absolutely need to see a sleep specialist, and that's in every textbook. Hey, Dan, I want to thank you. This has made my job really easy. Oops. Let me move on a little bit. Okay, I told you the story about this alcoholic. This was in the papers. A 90-year-old man choked his 87-year-old wife to death because her coughing kept him awake. It's a true story. I mean, people do crazy things in their sleep, but the judge, you cannot convince a judge that some people do stuff in their sleep. You can't. It's just, they don't believe in this sleep, but smart lawyers know that you can use this as a defense. Okay, what happens during sleep? This is the research. There's more blood supply going to the muscles, your body temperature goes down, and that's why you don't want to exercise late in the evening, because your body temperature is raised by exercise. The best time to exercise is early in the morning or during the daytime, not at night. Growth hormones are released. This is the healing. There's a boost in the immune system at night. The interleukins, these are factors in the blood come out, and there are neurotransmitters like norepinephrine and serotonin that are replenished. Now, it's just a part of normal aging that as you age, you sleep less and you have less time in REM sleep. So this causes more illness and increased use of medications. One thing I can tell you about sleeping pills, they are highly addictive. If you can avoid them, you should. But on the other hand, if you don't get any sleep, that's also a problem. So in each case, you have to sit down with your doctor, make him give you the time and discuss this issue. If you really don't sleep at all, or if your sleep study, I have had patients whose sleep study showed no REM sleep, 0. Do you think those people are functioning well? They're not. And if we do psychological tests on people like this, they don't function well. They can't concentrate. They can't do simple math. They can't. You tell them take 100 and take away 7, they don't come up with 93. Those kind of problems. Let's move on. So I think I talked about this. Ambien is probably one of the, if you are going to take a drug, Ambien is probably one of the best sleeping pills. It works like a charm. The problem is it has a lot of side effects. One more thing, one other sleep disorder we see all the time is called circadian rhythm sleep disorder. So what is circadian rhythm? In the brain, there is a rhythm. The body knows if you go to sleep and wake up at the same time, you don't even need an alarm clock. Your own body will tell you to wake up. Now, if you fly from west to east, you fly from San Diego to New York City, you're going to have more sleep disturbance. Also, a lot of people don't understand. You have problems in the stomach. You lose your appetite. My daughter, one of my daughters lives on the West Coast in Washington, D.C., very close. She works very close to the White House for a nonprofit there. When she goes from here to there, she has much more sleep problems. When she comes here, she's not hungry. I cook a meal for her, and Dad, I'm not hungry. So her circadian rhythm is off. It takes about 2 or 3 days for this rhythm to come back. So that's the time when you might want to take some melatonin or half a tablet of Ambien when you're flying to the West Coast, to the East Coast, sorry. Now, you can't drive if you're going to take any of these sleeping pills, and you can't take them. You can't take any pills really if you're pregnant, and tell your daughters that. and they produce tolerance. So after some time, you need more and more Ambien just to fall asleep for the same amount of hours. So it's really a dilemma, and they haven't come up with anything better. Now, I want to talk a little bit about nightmares. This was one of the most gratifying stories. I gave a talk at Tri-City Hospital in Oceanside many, many years ago, about 10 years ago. And a 90-year-old man liked my talk, and I had an office in Pacific Beach. He said, "I'll come see you." I said, "Sure. Here's my card." He came. He was a veteran of the Korean War, and for 10 years hadn't slept, 10 years, having terrible nightmares. He felt a army vehicle was coming at him in his sleep, and he had night terrors and stuff like that. I told him, "I know the solution for you. There's a drug called Klonopin, Clonapin. I gave him just half a tablet. He came back and literally touched my feet. He said, "You are the greatest." So treating sleep disorders is a very, very gratifying thing. I treated a lot of lung cancer, a lot of emphysema, a lot of COPD. I worked in intensive care for 30 years, but nothing I found more gratifying than treating sleep problems, because people really appreciate that. And all it takes is one night of wearing a wristwatch, something on your finger, and something on your chest, and pressing a button. And we've done this on tons of people, and it works like a charm. This is a drug, caffeine. So after 5 o'clock in the evening, if you don't drink coffee, you're going to sleep better. Many of the over-counter medications, almost every medicine has terrible side effects. Most of the more over-counter sleep medicines contain Benadryl, which is an antihistamine and used for, allergies. But the side effect of Benadryl is that it makes you sleepy. But again, it gives you a dry mouth, and the best way is to stay active during the day and don't go to bed until you're sleepy. Keep the bedroom only for sleep. I wouldn't even have sex in the bedroom. I would just have sex in the kitchen.
That's next week's seminar.
Okay, few more points, and then I'll wind up and take some questions. This is the most serious problem, is the most common problem that we see in the United States, obstructive sleep apnea. And the way the wife is trying to shut up this guy snoring, and that's how it gets diagnosed. It's caused by a failure of the muscles in the back. I show you a picture of that. And what happens is all night long, there are episodes where this passage in the back of your throat is getting blocked. And so for a few seconds, you're not breathing, and the oxygen goes down. Now, as lung specialists, we are highly trained to watch oxygen. That's what intensive care is all about. We are constantly watching people's oxygen, and we find there's no such thing as a minor procedure. Many people die from minor procedures. And San Diego is not a good place for medicine. I can tell you, I've practiced in New York, I've practiced in London, I've practiced in India. There's a lot of things that go wrong in San Diego hospitals, I've noticed. So, sorry to say that, it's not good news. These are the symptoms: snoring, gasping, can't even take a breath, frequent awakening, sometimes 100 times at night, and small drops in oxygen, 2 to 4%, but that can be substantial. One of the clues to sleep apnea is your doctor tells you you have a cardiac rhythm called atrial fibrillation. Anybody familiar with this?
Yep.
So, you see on Grey's Anatomy, the TV show, or General Hospital, whatever, up, down, up, down, up, down. The heart, the atria, the chambers on the top are fibrillating. They're not squeezing rhythmically. If you have that rhythm, for sure you've got sleep apnea, for sure. And the treatment for that, they put a lot of patients on blood thinners. That's the treatment. Because they don't want, if you have that rhythm, you're more likely to get a blood clot in the heart, which shoots off into the brain and causes a stroke. And I can tell you, I've seen everything under the sun, but nothing is worse than a stroke or a heart attack, stroke especially. Now, 95% of middle-aged men have this problem. It can also cause depression, high blood pressure, insulin resistance. You can die from this. Traffic accidents, hormone disruption, stroke. I think you get the point. This is the clue. Loud snoring, and patient stops breathing in their sleep.
Microphone.
Oh, sorry. Look at this guy. And I have had patients like this with a big, huge tongue. Of course, this tongue is going to block this passage here, and so he's going to have sleep apnea. One of the treatments, which is a very valid treatment for sleep apnea, is a dental device. But it costs a lot more money than having a CPAP machine. A lot of there are at least 5 or 6 dentists who specialize in sleep problems in San Diego. I know one of them in Encinitas. He's very good. He's done it for years. They make a special device that will stop your tongue from falling back and from your passage being obstructed. Few more points. Okay, here's a very simple solution to sleep apnea. These are called nasal cones. Everybody can see it from the back, I guess. These are little pieces of plastic that you put into the nose. It opens up the nose passage, and so prevents snoring, which is a great thing for the wife or the husband can snore. Women have sleep apnea too. It's not uncommon. And young kids have sleep apnea. 10-year-olds all over in Rady Children's Hospital have sleep apnea. And that's because they have big tonsils. And these tonsils block the passages. So here's, and there's also surgery for this. Here's a woman who has a very protruding jaw, and this is after the surgery. And here's the dental device in place. And here's an operation called uvuloplasty. So it's a plastic surgery operation. You cut off this tonsil, and you cut off the back of the throat. It's not a very good operation, really doesn't work very well. Here's the final, and I have had many patients who are 300-pounders, 400-pounders, 500-pounders, came to my office in wheelchairs. Treatment for that is to cut out a portion of the stomach. This is called a sleeve gastrectomy. Elizabeth Taylor had this operation, if you ever followed her movies. Elizabeth Taylor developed pneumonia. That's called the captain of death. Most older people, 80 to 90-year-old, die from pneumonia. Very simple disease to treat, but highly complicated. There are many kinds of pneumonias. One of the hospitals in San Diego got into trouble for billing the wrong code for pneumonia, and that was in the papers. They were fined, a huge fine. So this was the earliest treatment for sleep apnea. Make a hole in the trachea and then connect it to some oxygen. And Elizabeth Taylor had this. She had severe pneumonia, and she survived, and she became a great advocate for AIDS. I talked about narcolepsy. This is, anybody heard of Jazz Pharmaceuticals? Jazz Pharmaceuticals made a fortune on this, just one drug. This is the drug used for narcolepsy, and they're the only ones who make it, and only a doctor who specializes in sleep can prescribe it. So it's called Xyrem, and I've used it on a couple of patients. It works like a charm. I talked about restless legs. This is one called REM sleep disorder. These people actually act out their dreams. Some of them will walk out in the middle of the night and get into their cars and drive and not remember anything about it the next day. So that's called REM sleep disorder. They kick, they punch, they leap, and they run from bed, you know. One man in England actually shot his wife because he was dreaming about gangsters. So these are all true stories. This is what happens in sleep. You know about Fitbit? This company started off great, but this really doesn't give you enough information about sleep. But you can wear this on your wrist and it'll tell you something about your sleep, but not enough. So here are some tips for better sleep. Your bedroom should be dark. In fact, there are some light blocking curtains you should get. If your mattress is really old, please ditch it. There are so many fantastic mattresses now available. There's a new one called Lisa you can order online. That's really nice and firm. It should be firm, your mattress. I said this before, I'll say it again. Avoid computer screens, The blue light limits the production of melatonin. You want this hormone melatonin in your sleep. Down the road, Sprouts, I go there and buy chocolate-covered melatonin. It's really great, and it works pretty good. You need about 1 milligram, but most people need about 5 milligrams. But 1 milligram should do it if you're normal. Don't watch the clock. Just have a regular bedtime and wake up on a regular bedtime. Exercise early in the day. Don't have naps. This is one of the biggest killers of sleep in older people. I've had many patients who...
I disagree.
Why?
Because I take a nap every day.
Yeah. Well, depends how long your nap is, but if your nap is more than half an hour, I think it's going to affect you the same night. Some people need it. It's a very individual thing, but this is what the books tell us. Don't have coffee and turn off the TV. Here's the evidence that if you have excessive sleepiness, you may fuel Alzheimer's disease. I'll skip this slide because I've said all this. There's one more slide I wanted to show. Anybody know this lady? Comes on KPBS a lot. This is Dr. Amy Myers. She had a sleep problem herself. I've had sleep problems myself. Her solution was to wear amber-colored dark glasses right after her meal, and it worked. So Amy Myers has written a number of books on how to solve stomach problems and leaky gut, which is, where the intestines leak certain things, and she has solutions for that. She's written books on sleep, and she has her own website, Amy Myers.
Her New York Times bestseller list, autoimmune solution.
Yes, that's her bestseller. She also talks about thyroid disorder. That's Dr. Nasser, by the way. He's got a sleep clinic in La Jolla, and I consult for him. Finally, let me talk about, I know Ron's in the back. I don't see him anymore. Anyway, there are a lot of medical legal problems in sleep, and one of the doctors analyzed them. So half of the time, the doctor won the case, and half of the time the patient won the case. But the slide is not clear enough for me to discuss it. Everybody knows Deepak Chopra. He's a guy who brought all the wisdom from India, spent a year there studying under the gurus, and wrote a whole bunch of books. In fact, my videographer in the back makes videos for Deepak. Is that correct? And this guy makes $16 million a year just on his books and videos. And his books have a lot of useful information. This is a very small book he wrote, but he said one of the biggest causes of insomnia or bad sleep is job dissatisfaction. And the second biggest cause of insomnia is marital dissatisfaction. And that's probably a very ancient thing that he said. So this is a good book. I would recommend it. I think that's it. I'll take any questions. Thank you so much. How did Jim go? Any questions? Yes.
What about products like Sleepy Time tea? I use it, it seems to help me, or is it just in my mind?
No, I think it's helping you. That tells me that you don't have a serious sleep problem. If a tea can help you, that's wonderful.
Herbal teas like lemon balm, like lavender teas, they actually are sleep producing. They can give you very good quality. Lemon balm, and one of the teas which is actually really good that Indians still use it. Like historically, the Indians, the Hindus, they worship a shrub called tulsi. That's a very sacred leaf. It's called the holy basil leaf. So if you can make a tea out of it, or in Indian stores you can get those as tea bags. Holy basil. That is very, very good for sleep. I tried it myself. It calms you down and
You mentioned some others. I didn't talk about magnesium glycinate and serotonin-like substances, right?
Right.
5-HTP.
5-HTP. So these are all available at Sprouts or Jimbo's, and they help. But if you have, here's the main thing that I want you to go home with. For any disease, treatment depends on diagnosis. If the diagnosis is incorrect, the treatment's going to be wrong. So, information. People pay for information in this country like crazy. In fact, there are companies that work just on selling information. I didn't know this, but when I was in New York, if I ordered a pizza, the guy who sold the pizza to me was selling my phone number to a company. And so information is all you need, but diagnosis is based on the correct information. If your diagnosis is, yes, Dan?
Oh, I'm sorry, I'm going to finish your thought. I've got a question.
No, so if the diagnosis is wrong, the treatment is wrong, and the problem never gets solved. So this was what I kept teaching my students and still would teach them, that spend your time and do the right tests to prove your diagnosis. The sleep test is just a proof that you've got a sleep disorder, or it's information you don't have. You want to know, hey, my sleep test was great. I have so much REM sleep. I have so much light sleep, so much deep sleep. That's great. Then you know that you don't have a sleep disorder and a T can work for you. You don't need a CPAP machine and you don't need anything serious. Yes, Dan?
Do you have any studies on how the deprivation of sleep might affect one's reflexes relative to perhaps driving or everyday?
There's lots of there was at the University of Chicago, actually, until about 30 years ago, sleep wasn't even a specialty and wasn't even diagnosed. People just died from sleep apnea. And then Nathaniel Klein was a researcher at the University of Chicago, and he took a lot of students and put them in a cave in Kentucky and deprived them of sleep. And the studies showed that these people, their reflexes don't function well. They can't concentrate in the daytime. They don't have mental alertness, and the minute they have enough sleep, all these things reverse. So sleep is a natural state, and I think just the right amount. It's not the same for everybody, but I think the minimum is about 7 hours.
Thank you.
Yes.
I use my Fitbit a lot, and it's fascinating. I can see on the computer the REM, and can I pretty much, I have REM sleep 4 or 5 times a night. Can I pretty much believe my Fitbit? I mean, the Fitbits really keep track of that? Are they?
Yes, I think you probably have a pretty good sleep pattern from what you're telling me. But there's a lot more information that you get from a sleep study which you don't get from a Fitbit. Fitbit is only telling you how many hours you slept and whether you had REM and you didn't have REM sleep, But there are so many other things. It's not going to tell you about oxygen. It's not going to tell you about central apnea. So as you get older, talk about treatment. Dr. Nasser had a patient we treated last month with sleep, Sophie Riss. This lady had severe sleep apnea, had gone to Scripps Clinic, and they told her there was nothing wrong with her sleep. And we said to her, just let us test you. She was a nurse. She worked at Cornell Medical Center, and she worked at the Burns Institute in San Diego. We tested her. She had severe sleep apnea. One of my friends here has a sleep company, one of the biggest sleep companies in the whole state of California. He gave her a CPAP machine. We walked in the next day. No, the same day that he gave it to her, she said it's the difference between night and day. That's how much the right diagnosis, it makes a huge difference. So I would say if you have any symptoms, get tested. Can't hurt. I mean, it's a simple test. I don't know what people's concerns are. It's just so easy to do. Yes.
What should you do before you go to bed? You shouldn't get the computer and you shouldn't get the TV. So what do? Just sit there and...
You should really do
Go to sleep.
what Regina teaches, meditation. Meditation has been shown, and she has a class here, and Jennifer O'Leary is not here, but she has a yoga class. These things are very, very helpful to sleep. So you can be on your computer, but then you might sleep later and you might not sleep so good. I'm just talking about good sleep. If you want sleep where next day you feel energetic, that's the one clue. How much do you want to get out of bed and do something? One more thing they recommend, after your meal, go for a walk. We live in paradise. We have the best weather in San Diego. Why not go for a walk after your meal? Go for a long walk. I mean, a few blocks around the base is not going to do it. Stuart here walks 10 miles a day sometimes, right? Stuart and Sherry?
Every morning you'll see me at 5 o'clock, I walk 5 times.
Yeah, I mean...
It's because you can't sleep.
But for a minute, I want to make it advice.
You need more trips to the kitchen.
Actually, for men, I've got a very good advice. And believe it or not, is sex. Sex causes oxytocin production. And that actually is one of the most soporific agents ever. And that's the reason men, they have sex in this story.
But it has to be good sex.
Good sex. But the basic key element about going to bed is, as you mentioned, keep it dark. This light has got a blue spectrum. The blue spectrum, that light actually causes your cortisol to go up and melatonin to go down, like the seesaw effects. And it gives a feeling that you're in daytime, you have to stay awake. And unwired, rewired, whatever it is, or read a book, or just totally keep your mind away from any thoughts.
So read a book is good.
Reading a book is good. Not those racing novels, but, like...
Don't have a bright light, have a dim light.
But not on the iPad. Don't
Not on the
do
iPad.
that. Just a regular book.
Yes, ma'am. Oh, Marty.
Do you have a recommendation how to figure out how many hours sleep you need?
Well, you can't figure that out, but your own body tells you. And if you still want to know more, I would recommend a home sleep study. It's such a simple test to do. It will tell you how much sleep you're getting, how much is light, how much is REM sleep, how much you need, and that's the clue, really. How much REM sleep you get is how well you're going to function the next day. So, but I think if you let your body's rhythm guide you, the body is fantastic. It normally tells you when to wake up without an alarm clock. It tells you when to go to sleep. You just have to, most people don't listen to their bodies. And that's why we have all these problems in modern society. But there's no easy solution for any problem in life, let me tell you. Yeah, hi, Patricia.
What about deep sleep? Is deep sleep very important or less important?
Well, that's REM sleep. Deep sleep, REM sleep.
I'm 50 it is California. Hour and a sleep, I make a deep sleep. I have a 4.5 hours of REM sleep. So I didn't hear you talk about the deep sleep. What's the difference in
Abu, can you answer that question?
Yeah, actually, our sleep is comprised of the REM and the NREM, non-REM sleep. So that is actually that what dictates. So there's nothing for deep sleep is like saying that I've got a pounding headache. It does not emanate any scientific terminology. In the scientific world, we look at these two components. Now, the REM sleep is actually what is your sleep efficiency. That's just like any engine, just like any business or any kind of services, what we look at, what is the efficiency. So the REM sleep, if it is 25% or more, we know that you have a higher sleep efficiency. That means like you will be well rested. Now, even within that, we can give you a pie chart. It will tell you this portion is REM, this portion is non-REM, and that's the way actually we figure out your sleep efficiency, and it also tells you which side when you lie. Like if you are sitting on a prone to supine, or right prone or left prone, it actually tells us that your sleep is best in that posture. So that's the way we actually guide our patients.
But in scientific medicine, we don't use the word deep sleep. It's just REM or not. This Fitbit is not a really scientific thing. It's not based on hard science. So, Marty.
I've seen melatonin sold at 5 milligrams and 10. Does it matter what?
Sure matters. the dose of everything matters. So melatonin also comes in 1s, 5s, and 10s. Most people need somewhere between 1 to 3, most normal people. Some people need 5, and some need 10. You know, I would never start with a 10, I would start with half or 1, and then titrate up, you know. So that's why we have patients come back and say, okay, you took 1, tell me how you slept, you know. And they don't come back. So, yes.
I put a comment about melatonin. Melatonin should work very well at 1 milligrams, but there are like scientific trials actually underway that in 20 milligrams, it actually does something very unique. That is, it can actively kill cancer cells. So the patients with stage 3 and stage 4 breast cancer, they got benefit. And if you look at the civilized communities where people are under a lot of light, Las Vegas or cities with bright lights, the women have high incidence of breast cancer. And like 20 milligrams of melatonin, actually it promotes your NK cells, natural killer cells, that goes and fight against the cancer cells, and it does not touch your healthy cells.
Is it true that the melatonin, you should take it several hours before you are ready to sleep rather than right at bedtime?
Yeah, not right at bedtime. Probably half an hour before would be, by that time it's reached the blood and it has enough blood levels. But again, the main thing is the right dose of melatonin. And you and the doctor have to work that out, you know. You tell him I tried a 1 milligram and it didn't affect my sleep, he's going to increase it to 2 or 5. He knows, you know, from seeing so many patients which dose is going to work. So the dose of any medication is really crucial, you know. I mean, common medications we have seen disasters. Tylenol, most commonly prescribed. Which one?
Tylenol PM.
Tylenol PM is a sleeping pill, but that's got Benadryl in it. But again, Tylenol can damage the liver, and people come into the hospital with liver failure. Yes, ma'am.
You mentioned in your talking point, you take every night, for example. Is that really a side effect?
No, melatonin is fine.
Well, I read some papers that if you eat that very often, like say almost every day, and basically your whole body you cannot kind of generate it yourself. So kind of they say it's better to your own self system to kind of create the
It's a natural substance, so it's not a chemical. You know, chemicals have, or pharmaceuticals, they have side effects. Melatonin, the body produces melatonin, so it's just a higher dose of the same substance. Your own body, your pituitary gland produces that, or pineal gland, sorry.
The higher the cortisol levels, the higher melatonin you need to produce. Now, if you look at a modern man, every time they have cell phones, they're wired, they're getting calls, they're always under some stress, and it actually constantly, outpours cortisol. So you need that melatonin to basically neuter the effects of the cortisol.
I just wonder, what is the actual functionality of a CPAP machine? What does it do for the patient? I'm not familiar with it.
Yeah, so CPAP was discovered by Dr. Sullivan in Australia, and he was brought here by the guy who owns ResMed, and the guy's a billionaire now because he sold so many CPAP machines. It's basically like a bicycle pump. It pushes air through your nose, and it's like a stent in the back of your throat. It keeps the back of the throat open. So that's what the CPAP machine does. And I have quite a few friends here in Obej who use it and sleep very well. It's the gold standard, you know. The second, of course, is the dental device. Yeah, that's how it works. It just keeps the back of the throat open. Yes.
Just another practical suggestion. Some of us, I'm sure others in here, are very light sleepers. And you wake up with the slightest sound during the night or whatever, you have a window open, you name it. Nothing has worked better for us for the last 20 years than a sound diffuser. Now you can get an amp on your cell phone, but the sound diffuser, I use that as a psychiatrist for 50 years. You want everybody in the waiting room hearing what you're saying. Put the sound diffuser with white noise right outside the door, or with us, we have it right next to the bed, and if there's any louder breathing, or somebody gets up to go to the bathroom, or any noise outside.
Travel with it.
Yeah, all over the world, it works beautifully.
So this,
Very inexpensive.
so this sound diffuser, is it a machine or?
It's just a little machine, it's about as big as your hand, but on a cell phone, you just get an app for it, and that's
Yeah, I think that's
You do it on white noise, you have to play crickets and waves, and thunder,
But
jungle.
strange places where it's not soundproof, maybe motels,
There are also a lot of apps that help you go to sleep, on your cell phone. You can download a whole bunch of apps that'll help you.
What about, is it okay to sleep with a fan
Sure. Whatever puts you to sleep.
blowing on you?
Absolutely. My neighbors have the air conditioner blowing all summer. I don't need it, but we have barking dogs. There's an owl outside my door, There's all kinds of stuff. Yeah, I think this noise diffuser is a very good solution, and I would recommend that.
They sell one of those at Bed Bath & Beyond, they're like $15, $20.
Yeah, absolutely. I don't think it's a big deal. Well, all of you have a good night and sleep well. Thank you again, Dan.